Nurse Ada, what is heart attack? A heart attack, or what we call myocardial infarction in medical term, occurs when a blocked artery prevents reaching a section of the heart. It is often caused by a blood clot or a buildup of plaque in the arteries. If the blocked artery is not reopened quickly, the part of the heart begins to die. The longer a person goes without treatment, the greater the damage. That's the reason why in the hospital we have these protocols to follow. We announce a code overhead to expedite the process to treat the patient. We give intervention to save the heart for further damage. The heart muscle needs oxygen to survive. When the blood flow is blocked, the muscle cells begins to die. That is why when you feel chest pain that cannot be relieved by rest, you need to be rushed into the hospital to resolve the obstruction and restore blood flow. What do you feel during the heart attack? You may feel pain in the middle of the chest that can spread to the back, jaw, or arms. Sometimes people feel pain in their stomach, like indigestion, fainting, sweating, nausea, shortness of breath, heavy pounding of the heart, abnormal heart rhythms, loss of consciousness, restlessness, anxiety, bluish lips, hands and feet, cold and clammy skin. Older people may have symptoms that resemble a stroke and may become disoriented. Angina is a medical term for a temporary chest pain. The pain comes and goes, but when you have a chest pain that happens more often, it should be taken seriously. If the chest pain not get better by resting or taking a nitroglycerin pill, that is a sign of heart attack. But Nurse Ada, a lot of us don't have a nitroglycerin at home. Yes, that's true. Nitroglycerin helps to open up the blocked artery in your heart. But bottom line is that heart attack is emergency and you cannot waste time. So it is better to call an ambulance. The EMS or the ambulance staff will give you nitroglycerin after they check your blood pressure. They will also administer oxygen while you are in your way to the hospital. Sometimes they also give you pain medicine like the morphine. Morphine helps the pain and at the same time helps with the circulation. Heart attack or myocardial infarction is a painful condition with tightness, pressure, or squeezing pain in the chest. This pain often radiates to the arms, jaw, or back. Nitroglycerin bring relief to many patients, but up to one-third of those who experience MI have nitrate-resistant chest pain, and morphine helps in that kind of situation. Oh, I see. Treating the pain in MI patients is critical, as pain activates the sympathetic nervous system and causes or aggravates diaparesis, weakness, lightheadedness, and palpitations. This in turn increases the cardiac workload. Morphine is a potent opioid. It is the ideal analgesic to relieve the pain. It decreases heart rate, blood pressure, and venous return. Morphine reduces myocardial oxygen demand. Oops, hold on. That sounded a little bit a medical term to me. Okay, when you are in pain and there is a blockage on the artery of your heart, there is not enough blood going to that area of your heart. The tissues in your heart needs oxygen and nutrients. The first thing you feel is pain, so your heart rate and blood pressure will increase. When your heart rate and blood pressure increases, the more your heart will work hard. So what happens when your heart is working hard? The more problem it gives. The heart will need more oxygen to work. Remember I told you before, all the tissues needs oxygen and nutrients from the blood. So if there's not enough blood supply, the tissues will die. So that's going to happen with your heart.
Oh, I see.
Okay, now we will continue with the symptoms. The symptoms of a heart attack may be immediate and intense, but more often, symptoms start slowly and persist for hours, days, or weeks before a heart attack. Unlike with sudden cardiac arrest, the heart usually does not stop beating during a heart attack. The attack symptoms in women may also be different than men, so it's better to tell your doctor if you feel discomfort in your chest or your abdomen. So, how can we confirm heart attack? A heart attack can be confirmed within a few hours after it happens by using ECG and blood tests to measure levels of serum markers like the cardiac enzymes. The presence of these markers shows that there has been damage or death of the heart muscle. These markers are normally found in the heart muscle, but they are released into the blood when the heart muscle is damaged. Echocardiography can be performed if the above tests do not give enough information. Radionuclide imaging can also be done, but the usual process we do in the hospital is to do ECG and obtain cardiac enzymes right away, soon the patient arrives. But since we're trying to save time, the EMS or the ambulance staff do the ECG soon they see the patient. Oh, wow, that's good. How do you treat heart attack? Heart attack is a medical emergency. To prevent further damage to the heart and death, we start giving interventions soon we see the patient. The sooner the treatment of a heart attack begins, the better. We already developed a system in the hospital over the years, but for the patients, they need to know what to do. First, you need to call the ambulance. It is important to save time because the longer time wasted, the more damage will be done. Chew an aspirin tablet while waiting for the ambulance, if you have aspirin at home. Aspirin can help reduce the size of the blood clot. Soon the ambulance arrives. They usually take your blood pressure, ask you questions when is the chest pain started, while they are obtaining your EKG. They will give you oxygen, nitroglycerin sublingual, and possibly morphine. The ambulance will go to the nearest chest pain center hospital. While on their way, they will call the hospital. The hospital will announce a code overhead to activate the rapid response team. The goal is to check the blockage immediately. Soon the patient arrives. The team will perform EKG, obtain blood to check the cardiac enzymes, and shape the patient in preparation for the heart catheterization. But sometimes you don't have to do the heart catheterization, depending on your EKG. By looking at your EKG, we will know when does the injury in your heart happen. The doctor will decide what kind of treatments he will order depending on the severity of the damage and onset of the injury. Sometimes they will put you on a heparin drip while waiting for other procedure or while they are studying your case. A heparin is a blood thinner that helps prevent the formation and growth of blood clots. What is cardiac catheterization? Cardiac catheterization, or also known as left heart cath, is a procedure to check your heart. This test uses a thin, long, flexible tube called a catheter that is inserted into the heart through blood vessels in your wrist or groin and guided to your heart with the aid of a special X-ray machine. Your doctor will make a small cut over the blood vessel. They will insert a device called an introducer sheath and thread the catheter through it into the arteries of your heart. The doctor will use contrast dye, inject in your blood vessel through the catheter, to create X-ray videos of your valves, coronary arteries, and heart chambers. The doctor can use cardiac cath to both find and fix problems. Procedures that might be done during your cardiac cath are angioplasty and stent placement. In angioplasty, the doctor inserts a catheter with a tiny balloon at the tip. When this balloon is inflated, it pushes plaque out and widens your artery. In stent placement, the doctor places a tiny mesh tube called a stent into your artery to help keep it open. There are several risks in cardiac catheterization. These include a hole going through your blood vessel, or that's what we call perforation. That's the reason why we have a backup cardiothoracic surgeon in case this might happen. Another risk is air embolism, or when air gets into your blood vessel. This can be deadly. Another risk is allergic reaction to dye. Another risk is stroke. While they are doing the angioplasty, they can detach the plaque or clot from the wall and might travel and cause stroke. Another heart attack might happen. It's because the doctor is using balloon to press the plaque and might occlude the circulation. Another risk are infection, arrhythmia, or irregular heart rhythm, bruise around the insertion site or bleeding, and damage to the kidney from the dye. Oh wow, that's a lot of risk. Well, in every procedure that we do, there's always a risk. It could happen, but it doesn't mean it will happen to you. The percentage of the risk is very minimal, but the benefit of doing the procedure will save your life. Yes, I agree. Life is more important. You can deal with the risk anyway. Yes, the doctor and the hospital is ready for this risk. How long does a cardiac catheterization last? A cardiac cath procedure usually takes about 30 minutes. Longer if they have to do an intervention like the angioplasty or stenting. But the preparation and recovery time sometimes takes longer, so add several hours. You might stay in the hospital for at least 1 day. It's because they have to monitor the insertion site for bleeding and infection, and monitor your heart rhythm and draw blood to check the troponin level to make sure it's going down. Troponin indicates myocardial damage. It should trend down after the heart attack event. What happens during a cardiac catheterization? We will put you in a hospital gown and shave you to the area where they might possibly insert the catheter. We will put an intravenous or IV needle in your arm in order to give you medications and fluids. The cath lab room looks like an operating room. You will lie on a special table. A large camera and several TV monitors will be above you. You can watch the pictures from your cardiac cath on the monitors. The nurse will put electrodes as sticky patches in your chest. The electrodes are attached to a monitor so they can monitor the heart's electrical activity during the procedure. The doctor will cover the site with sterile cloths to help prevent infection. Do not move suddenly and keep your arms and hands at your sides so you don't move the drapes. Tell them if you wanted to move so they can secure the drapes. The doctor will give you a mild drug to help you relax, but you will be awake during the procedure. Your doctor will use a medication called a local anesthetic to numb the area where the catheter goes in. This could be at your groin, we call it femoral approach, or on your wrist, we call it radial approach. The doctor will make a small cut over the blood vessel. They will insert a device called an introducer sheath and thread the catheter through it into the arteries of your heart. You might feel some pressure, but should not feel pain. If you feel any pain, tell the doctor. When the catheter is in place, they will dim the lights and insert a small amount of dye, also called contrast material, through the catheters into your arteries and heart chambers. The contrast material outlines your vessels, valves, and chambers. When the doctor injects the dye into your heart, you may feel hot or flushed. This is normal and will go away in a few seconds. Tell the doctor or nurses if you feel itching or tightness in your throat, nausea, chest discomfort, or any other symptoms. The X-ray camera will take photographs of your arteries and heart chambers. Your doctor may ask you to take a deep breath, hold your breath, or cough during the procedure. You will need to hold your breath while they are taking the X-rays. What happens after cardiac catheterization? After the procedure is done, they will remove the catheter and might remove the introducer in the cath lab. They will pull the introducer and apply manual pressure until it stops bleeding. Sometimes the doctor will decide to use a closure device to close the punctured site. The reason why they keep the introducer for a little bit longer is when they used blood thinner. The nurse will draw blood to monitor how thin the blood is and must reach the safe level before he or she can pull the sheath. If the catheter was put in your wrist, the doctor might put a TR band. It is an inflated plastic that will press the site after the doctor pulls the introducer. After several minutes, the nurse will remove the plastic by slowly removing the air from the TR band until all the air comes out. Tell your nurse if you think you're bleeding or feel any numbness or tingling in your fingers or legs, depending on the punctured site. You will need to lie flat and keep your legs straight for 2 to 6 hours to prevent bleeding. The nurse will tell you how many hours you will be on bed rest. To avoid straining your abdomen and groin, you will need to keep your head low, no more than 2 pillows high. You won't be able to sit up or stand during this time. The nurse will check the dressing or site regularly. But tell them if you think you are bleeding, have a wet or warm sensation on the punctured site, or if your toes tingle or feel numb. You might get medication to help with discomfort after the anesthetic wears off. Your nurse will help you out of bed when it's okay for you to get up. Your doctor's orders will let you know when you can get out of bed to go to the bathroom. The nurse will help you to sit up and dangle your legs on the side of the bed. If you didn't get a urinary catheter during the procedure, you will need to use a bedpan or urinal until you are able to get out of bed. Oh wow, that's a lot of information. Thanks, Nurse Ada, for sharing your knowledge about heart attack. At least I know now what to do. You are welcome, Jenny. To our viewers, I would like you to press subscribe and the like button in my YouTube channel. Follow me on Facebook for more videos. Thank you for your support.